You cannot diagnose someone with ASD simply by the way they speak. However, there may be certain speech characteristics that are more commonly seen in people with ASD. I'm Matsuzaki, Asaki Matsuzaki, a psychiatrist. This time, I'd like to introduce 4 characteristics of the way people with Autism Spectrum Disorder, or ASD, may speak. Let's get right into it. First, people with ASD have been reported to tend to keep their vocal cords more tightly tensed. As a result, their voices tend to be slightly higher in pitch and may give listeners a subtle sense of tension in the quality of the voice. They may put too much effort into trying to control their own voice, or they may have difficulty with the fine muscle regulation required for precise movements of the throat. These are thought to be the reasons behind this. As a result, rather than producing a relaxed and natural voice, an unconscious sense of tension is thought to come through in the overall sound of their voice. And second, most people normally listen to their own voice as they speak and unconsciously make real-time adjustments to its pitch and volume. In people with ASD, this process is thought to work somewhat differently, and their voices are said to show much less variation in both pitch and volume over the course of their speech. These subtle variations in vocal intonation are also one of the ways we communicate our emotions. People with ASD, however, may find it somewhat difficult to express their emotions by using such subtle variations in intonation. And now third, the rhythm and overall speed of speech are also said to show characteristic features in people with ASD. Their speech has been reported to pause at unusual moments or suddenly speed up while they are carrying on a conversation. This is thought to be due to 2 factors. One is that people with ASD may have unconscious difficulty with the coordination between breathing and the rhythm of speech, which can lead to distinctive pauses in their speech. The other is that during conversation, organizing a coherent flow of speech while adapting to the other person throughout the conversation can place a considerable burden on them. These are thought to be the 2 main reasons. And finally, fourth, people with ASD have also been noted to have distinct characteristics in the content of their communication. It's well known that people with ASD often have difficulty using metaphors in their everyday communication. They may also have difficulty choosing the appropriate words depending on the context. In addition, they may struggle to use appropriate conjunctions in the right context. Furthermore, when explaining something, they may have difficulty communicating the overall picture. These characteristics have also been reported. So I've introduced 4 characteristics of the way people with ASD may speak. But please, don't try to diagnose someone just because you notice one of these characteristics and think they have this characteristic, so they must have ASD. That's simply not how ASD is diagnosed. Please don't do that. Instead, I hope that by understanding these characteristics, you'll gain a much deeper understanding of what ASD is really like and why some people with ASD may speak in the ways we've discussed today. That's all.